Hi folks, I'm Dan Dworkis and this is The Emergency Mind. In this video, I'm going to share with you a longer extended version of a talk I'll be giving at the California AAEM Golden State Symposium on visualization and mental simulation training. It's a really deep dive into how to move beyond just basically thinking about stuff to becoming an active and powerful participant in doing visualization training that will help you improve your subsequent real-life performance at skills under pressure. There's a lot in there, and there's a lot of space in there to actually practice visualizing as you're listening. So, all that said, I hope you enjoy. Hi folks, I'm Dan Dworkis, and in this talk we're going to be covering visualization, mental training, and mental simulation. My one disclosure is that I run a group called The Emergency Mind, which brings together lessons from the ER and beyond about performance when it matters the most and applying knowledge under pressure. Our objectives for this talk are to talk about the best practices for mental simulation and visualization, and to really deeply explore 4 methods that we can use for improving and deepening our mental practice. We're going to actually spend a lot of time exploring and putting those into play, and my hope is that you find 1 or 2 that you enjoy and want to keep working on. So first off, what is visualization? Well, when I started practicing, I used to think about visualization sort of like what this monkey is doing, just kind of passively sitting around and thinking about things. Over time, though, I've come to believe something very different, which is that visualization is an active mental performance of a process in order to improve subsequent real-life performance. Now, there's really 2 keys here. First, visualization is active, not passive. You don't just sit around and think about things. You actually have to design a very structured experiment and then employ your mind to build that experiment. The second thing is that it's designed with a purpose, and that purpose is to improve your subsequent real-life performance of a particular thing. So visualization is a skill, and it's a skill that we can get better at. And I hope that's what this talk does, is give you some tools to get better at your own visualization. What I want to do is get us away from the left side of the screen where we're just sort of passively thinking about something, and more towards the right side of the screen where we're an active participant designing and running mental experiments and seeing how we perform in those unique environments. Now, I'm not really sure what this person is doing. It looks like some sort of techno magic, and I don't expect us to get there, but I want to get us closer to that, to the point where we can actually use visualization to deepen and improve our own skill set. So, why do we use visualization? Well, this is a scene from a sim lab, and when I was a resident, I used to really love going to the sim lab. It was a place where we could practice and explore, a place where I could continue to get better at things I didn't maybe feel comfortable enough with in the real life environment. But it's inherently limited. You can only access a sim lab when it's open, and you're sharing it with a lot of other people. Visualization in that sense is really like a personal mental sim lab. So what it allows you to do is practice basically anything, even things that are too dangerous to practice, too rare, where there's not a set up sim for it. You can basically practice anything you need to work on. And it's always open and you have unlimited access to it. Now, that's especially important during the COVID-19 pandemic, when getting to sim lab is not always possible. And we do things like give talks at conferences over this sort of strange video setup. But even outside of the COVID pandemic, visualization is a mental sim lab that is always available to you. And in fact, it's perfectly tailored to you. So if you're a beginner and you want to practice very basic building block skills, perfect. Visualization can help you do that. If you're more advanced and you want to fine tune the way that you're navigating through a particular case or doing a particular skill, no problem. Visualization can help you do that too. The other reason we use visualization is frankly because it works. And this picture is supposed to remind you of sort of neurons and the connections of what goes on in the brain. So we're going to skip some of the science here because this talk is more about the actual deploying of visualization than how it works. But basically, visualization works by activating the same parts of our brain that get active when we do a particular skill. So if I'm an archer and I'm visualizing shooting an arrow, that practice of really in high fidelity, detailed visualizing shooting an arrow will activate the same part of my brain as shooting that arrow will. And over time, that will solidify circuits and help me get better at performing that skill in real life. So here's a partial list of things that visualization has been proven to improve your ability to do, ranging from everything like finger strength to free throw shooting, all the way up to cricothyrotomies and performance under pressure. So the title of this conversation is Visualization and Mental Training 201. But before we do that, we really need to take a step backward and look at Visualization and Mental Training 101. And what this will let us do is dive into what some of the best practices are for what makes visualization rich, worthwhile, and powerful. So let's start with a basic case. Imagine you have a 40-year-old female who has a history of CHF, presenting with shortness of breath for a day. Her initial vitals show a temperature of 39, a heart rate of 109, a blood pressure of 230 over 130, a respiratory rate of 28, and she arrives satting 80% on 4 liters nasal cannula. On exam, you can see that she's really tiring out and having a hard time breathing. She's having crackles on her lung exam and has a distended JVD. Has JVD. On a quick bedside ultrasound exam, you see that there are B-lines everywhere throughout her lung fields. What we're going to do is we're going to visualize intubating this patient. And I want each of you in just a second to do that. Now, normally when I give this kind of a talk, I'm doing it in a room full of people, and we're able to see exactly when people are done visualizing because they look up and look at me like, okay, what are we going to do next? We don't really have that luxury at this moment. So the workaround we're going to use is that we're going to set a timer on the computer that's going to help us understand when it's time to move on. So I'm going to tell you to visualize, and then what you're going to see is something that looks like this, a bar traveling across the screen. When time is up, you're going to get a little bit of an applause, presumably because you did a good job intubating the patient. All right, so let's try that out. What I want you to do now is get ready to intubate that patient. Ready? Let's do it. Okay, patient's intubated. How did it go? So if you're like me, when I started doing this, I would find that I visualized what I would maybe think is the most important or interesting part of the procedure, right? So maybe I visualize putting the Mac blade in and passing a tube through the cords. And I would sort of stop there because I'd visualize the part that I think about the most. Now, in some sense, that's good. And if you are doing a visualization as a very beginner, when you're really trying to work on placing the tube through the cords, that's an excellent thing. But on the other hand, if you're already past that, that's a pretty limited way to do it. And especially if you keep visualizing over and over again the same thing, it's maybe not really getting you any better at what you're trying to do. So my guess is that while most of you might have visualized the tube passing through the cords, a very small number of you probably visualized setting up suction, calling out the medications that you wanted, making sure your nasal cannula was in place. And a small number probably visualized bagging the patient after the tube was in, and an even smaller number probably visualized in that period of time calling out the initial vent settings you wanted the patient to be put on. Of course, we know that all of those things I just described are actually part of intubating a patient. And so we can sort of expand the way that we visualize to take more advantage of the time that we have in order to do a deeper dive into our skills. So here are best practices in mental visualization. And these are 4 things that research in visualization and my conversations with high performers from a variety of fields through the emergency mind has shown us that really improve your visualization. We're going to dig through each of them in turn. So let's dig into it even more. So first, we want to make sure that we use multimodal cues to build a rich environment. So what that means is that we want to make sure that we create an environment to perform in that is as lifelike and Okay, so let's really dig into what these things mean. So first off, we're going to use multimodal cues to build a richer simulation. And what this means is that we're going to use different parts of our brain to really increase the depth of what we're visualizing. So visualization, in a sense, is sort of not the right word, and mental simulation is actually a much better word because visualizing imagining what we see when we do something is one of only many different senses that we can and should engage. And the more rich and multi-sensory we're able to create a simulation, the better it will be for our brain, and the better and more useful we will be at leveraging that to perform. So what else do we have other than visualizing? Well, auditory. What do we hear when we're in that room? When we're getting ready to set up and intubate the patient, do we hear the monitor in the background? Do we hear people moving? Are there certain people calling out for things? What about kinesthetic or tactile? Do we feel the weight of the intubating handle in our hand? Do we feel what it feels like when we scissor open the patient's jaw? What does that feel like on our fingers? What about when we move the patient's head or adjust? You can also, of course, simulate the internal environment, just like you'd simulate the external environment. So as you're going through this intubation, what are you feeling? What emotions are running through you? Do you feel your own heartbeat? Do you feel your pulse racing? Are you sweaty? Are you calm? What does that feel like? And you can explore changing each of those different pieces to create the richest possible simulation that you can come up with. All right, 2, we want to perform it in a detailed and accurate environment. Now, when I first started intubating, again, I would imagine intubating in sort of a featureless gray room, some sort of part of a spaceship or something where all that was there was me and the patient in front of me, and I could calmly open their mouth, place a blade, and place a tube. Of course, as all of us know who practice in emergency departments, that's not real life. And intubations happen in particular circumstances. So you might ask yourself, where are you going to execute this particular skill? Is there a particular trauma bay that you work in routinely, or a resuscitation bay? Or if you're a paramedic or somebody like that, are you routinely going to be intubating in the back of an ambulance rig? Whatever it is, you want to try to create that environment around you in your visualization. Now, you can start simple and then you can move complex. Perhaps to start, you add in the shape of the gurney underneath you, you add in the walls, you add in 1 or 2 key players, and you drill and drill and drill in that mental environment. Then, once you've gotten the hang of it, you can really broaden your horizons and build a much more detailed, accurate environment. Try to create in your mind as absolutely high fidelity of a space to practice as you possibly can. All right, third, we're going to think about leveraging expert technical knowledge. Now, what this really means is that the better we understand a process, the better we are able to use visualization to train it. So if we don't really understand how to intubate somebody, none of this other stuff that we're going to do is going to help us learn to visualize intubating them. So if you don't understand the skill, before you visualize, you want to stop and read about it. Watch some videos about it. Sort of front load in your mind what it's supposed to look like, and then visualize yourself doing it. Okay, I use this technique all the time when I'm visualizing myself performing really rare procedures. So for instance, something like a perimortem C-section, which thankfully so far I have not had to do in real life. I'll watch a video of it being performed, and then I'll run the visualization in my head over and over again. And to me, that is really able to help me leverage that other expert knowledge to create the best simulation possible. Finally, we want to end all visualizations in success. So if you find yourself visualizing doing a performance and you get stuck partway in the middle, make sure that you keep it through and succeed at the end. All right, what that allows us to do is create the mental patterns in our mind that says, when I start this, I succeeded it. And it helps us improve confidence in ourselves and build resilience to whatever initial setbacks we might incorporate. Okay, so let's run it again. I'm going to give us slightly longer this time. And what I want us to do here is, again, visualize intubating that patient. Remember, she's short of breath. She needs that intubation to happen quickly. We're going to visualize doing it, but we're going to use some of these skills we just talked about, okay? We're going to use multimodal cues. Maybe you want to pick 1 or 2. You want to hear the monitor behind you or feel the Mac blade in your hand. We're going to do it in a detailed and accurate environment. So you're going to create that mental space around you. You're going to leverage expert and technical knowledge, which is to say that you're going to try to do the best you can to do it perfectly. And you're going to end in success. You're going to end having successfully intubated this patient. All right, ready? Let's get to it. Awesome. Okay, so maybe that felt a little fast. 20 seconds all told is not much to create a super deep, really involved, rich visualization. That's okay. Visualizing is a muscle, and the more practice you get at doing it, the better you'll be at doing it. Now we're going to get to the 201 section. And what we're going to cover is 4 specific techniques that help us create even more interesting, purposeful visualizations. These are going to go beyond the basic idea of visualizing a technique because each of them is going to be focused on a very particular thing we need to get better at. Okay, let's start with technique number 1, the detailed loadout. Now, what this technique is about going step by step through a process and leaving absolutely nothing out. You want to go in absolutely excruciatingly in-depth detail about the entire procedure. And you want to make a note of what feels weak to you as you go. Those are going to be the areas that need improving. To make that a little more explicit, what you're going to try to do is be aware of negative space. Now, what I mean by this is areas where you have trouble visualizing what's happening. Now, if everything in your mind is crisp, perfect, beautiful, high fidelity, but there's one thing that you're doing that it's just a little fuzzier, it's a little low res. That's perfect. That's what you want to find. That's a signal to you that whatever it is that you can't perfectly visualize, that's an area where you need to practice and improve. When you do find that negative space, you have essentially 2 options. One, you can do it like a black box where you say, okay, well, I'm going to compartmentalize that step. I'm going to push it aside for later, and I'm going to continue with my visualization because I want to get all the way through to the end and end with success. Or you can say, you can run it as a don't pass go scenario where you say, okay, that teaches me I need to stop visualizing. I need to go study that one particular step to the point where I can come back and visualize it in high res. Then you run from the beginning all the way through again. Depending on what your goals are for a particular session of mental simulation, you might choose one or the other. So let's go back to our patient who is desperately in need of being intubated. And we're going to visualize it again. This time we're going to go step by step and we're going to leave nothing out. And we're going to try to identify this negative space. I'm going to give us a little bit longer here because step-by-step visualizations take longer because we're going slower. So you're going to get about 30 seconds to intubate this patient. All right, remembering everything we learned at the beginning, our 4 basic pillars of deep, powerful visualization, and now this time adding this second tool about going step by step. Let's do it. Again, the purpose of this was to go step by step, and hopefully in doing that, you found a couple of areas that were maybe just a little bit weaker at visualizing than others, and those are areas that you can go back and train and improve. Okay, technique number 2, perform a pre-mortem exercise. Now, a pre-mortem is essentially this idea, which is that imagine the simulation or imagine the situation is over and unfortunately you failed. You want to use visualization and mental simulation to work backward to try to figure out how did you fail? What's the most likely kind of thing that went wrong? And what does that teach you about areas that you need to improve? So in this case, we're going to imagine again visualizing that we're going to intubate this patient, but unfortunately we weren't able to secure her airway. We ended up in a can't intubate, can't ventilate situation, and unfortunately the patient went into a cardiac arrest. So why did that happen? How did we fail? What parts didn't work the way that we wanted them to? Starting at that assumption that you failed, run your visualization and try to run it backwards and try to identify where it was that you went wrong. All right, ready? Let's get to it. I left the applause in as the end of this one because the purpose of doing this is to understand that anytime we encounter a failure, we're going to use it to learn, and we're going to use that learning to breed future success. So even though premortem exercises start at failure and might seem therefore to violate the tenet of always end in success, it's really only a stepping stone to running it forward again. So if I was doing a premortem, or when I do a premortem visualization, I'll start saying, okay, I failed. I'll run backward until I figure out why I failed. For instance, maybe I didn't anticipate a particularly anterior airway in this patient, and I didn't have my backup equipment in ready reach. When I identified that potential point of failure, I'll then start over at the front, run the visualization again going forward, this time having accounted for that potential point of failure and succeeding at the technique. All right, number 3, pressurize. So the purpose of this is to add stress to our visualization and really to test our systems under pressure, and test our ability to respond to the pressure that we might feel in a real life environment. Now, what this allows us to do is practice performing under pressure, also to identify areas that need improving, and to train our actual pressure response systems. What this gets into is this idea right here, which is the Yerkes-Dodson curve. And here we have a graph of performance on the y-axis and arousal or sort of stress level on the x-axis. And what we find is that most people follow some sort of a bell curve like this, which is that we have some optimum performance when we're a little bit hyped up and a little bit jazzed up. And probably this is true for everybody listening to this as you're involved in emergency medicine to some degree. Now, if we have really low levels of stress or arousal, we tend honestly not to perform as well, in part because we're bored. And if we have really high levels of stress and arousal, we tend not to perform as well because we're frazzled or overwhelmed. So the sweet spot is there somewhere in the middle. Now, a particular challenge of visualization and mental simulation practice is that, generally speaking, when we're simulating in our mind or visualizing, we're at a much lower level of stress and arousal than when we're actually performing. Doing the thing in real life makes us a lot more amped up than just thinking about doing the thing does. So in order to account for that, we can add pressure to our visualization. Oh, right, sorry. What is this called? It's actually the Hebbian version of the Yerkes-Dodson law. Duh, not just the normal Yerkes-Dodson law. Okay, so we're going to add stress to our visualization in order to mentally move us on that Yerkes-Dodson curve and to try to create a situation that is more high fidelity to how we're actually going to perform the technique in real life. And there's 2 basic ways to do this. We can either add emotional pressure, or we can add something that's like physiologic pressure. So emotional pressure is adding in some of the stress or anxiety that we might feel when we're trying to do a particular thing. So maybe when we're actually intubating somebody, we're really worried that we're going to miss. We have somebody who is making us really anxious watching us. We have a senior resident or a fellow attending, or it's a really highly emotionally charged situation, right? Maybe instead of a 40-year-old woman, it's a young child, and we feel a lot for that child and for their family. Maybe we have a family member yelling at us. Whatever it is, it's the idea that there's this extra added emotional stress on what we're doing that we need to account for. Physiologic pressure, on the other hand, is what our body does when we respond to certain types of stress. It's our elevated heartbeat, our sweat, our butterflies in our stomach, so to speak. And it's very similar to what we might feel as we're undergoing a physical workout. And as anybody who's intubated in the middle of a high stress trauma knows, your heart rate goes up very, very quickly. And accounting for that, and accounting for the slight tremor we might feel in our hands as we get to that elevated heart rate, is an important part of actually performing that technique. So we're going to add pressure. How do you do that? How do you add pressure? Well, if you want to add emotional pressure, you want to visualize a component in the room that adds that emotional pressure to you. So if it's a screaming parent, if it's a really stressful coworker, probably there's somebody that you can think of right off the top of your head that just makes you a little anxious. Maybe you're terribly afraid of bees. Great. Imagine somebody unleashed a swarm of bees into the room at the same time, and you have to handle that as you're performing this intubation. Pick something that stresses you out and bring it into that mental simulation. If you're going to add physiologic pressure, you want to do that by actually getting your heart rate up, getting yourself sweaty, and making that part of the way that you visualize. So I tend to do this by borrowing physiologic stress from other areas, which is to say that I tend to do visualization when I'm already physiologically amped up. So looking out the window sort of this way where I am in my home, there's a nice hill. And when I run up that hill, at the top of the hill, I'm really out of breath at the end of one of my training sessions. And right then when I'm sweaty and tachycardic and at the end of a workout, that's when I'll do mental visualization and simulation, because I'll already have that physiologic pressure ongoing, and I can use that to improve my performance. So what we're going to do for this round of visualizing is we're going to add pressure, and you can either pick adding emotional pressure by adding in a swarm of bees or whatever it is that you're afraid of, or physiologic pressure by taking the first couple seconds of this visualizing practice to drop and do some push-ups. All right, pick whatever way you want to add pressure, and let's do it. Ready? Let's go. Okay, the first couple times you try to visualize when you're adding pressure, you might find that all you can think about is the pressure. For me, when I do this, I visualize one or two attendings that used to just absolutely stress me out when I was a resident. And I still picture them hovering over me, sort of watching what I'm doing. And then occasionally I also unleash a swarm of bees into the room to see how I would handle it. So the first couple times you do that, you're probably just going to concentrate on what that looks like and what that feels like. And you're going to have to remind yourself, wait, I'm trying to intubate somebody. Same thing the first time you try to do this mental visualization after you're already physically amped up, you're going to be feeling your heart rate. You're going to be feeling your breathing. You might have to remind yourself you're there to intubate somebody. That's okay. With practice, with repetition, you're going to be able to more easily handle that type of pressure until you really will be as cool as a cucumber. Doing that is incredibly important because that has really direct real life applications when you try to intubate somebody in real high pressure environments. All right, number 4, and this is the final and my favorite of the techniques, which is stumble and recovery drills. So the idea here is that you start a visualization partway through a technique when something has already gone wrong. You've tried to intubate the person and for whatever reason, it didn't work. Maybe their airway's too anterior and you're having trouble reaching it with the blade that you'd initially picked. Okay, what you're going to do is start the simulation there. You're going to visualize your recovery, and then you're going to visualize your ultimate success at the procedure. Essentially, what this allows you to do is practice your recovery moves. Okay, so let's get to it. We're going to visualize intubating this patient, and we're going to imagine starting with something going sideways. For me, I'm going to start with their airway being too anterior where I can't quite reach it. We're going to visualize what we're going to do about that, which involves both recognizing the problem, designing a strategy to address it, and then executing that strategy to address it. And then we're going to visualize successfully moving past it and ultimately succeeding in intubating the patient. All right, ready? Take a second and think about what your initial stumble will be. All right, you're going to start there. Let's get to it. Okay, that was good, except that now let's imagine whatever you just came up with as your recovery move. Sorry, it didn't work. The patient is now desatting even more and she's satting in the 60s. The problem is still there and that technique you picked, it didn't work. So run it again. Find a different recovery move. Go. Okay, wait, actually, nope, that didn't work either. So whatever your second recovery move is, no dice. The thing you were holding fell on the floor. The video broke. Whatever it is, didn't work. You're gonna have to try one more time. All right. And at this point, you actually find yourself in a can't intubate, can't ventilate situation. So now imagine what you're gonna do. But let's get it. Let's succeed in securing that airway. Nicely done. You definitely deserve that round of applause, right? One thing you can do, as we've illustrated here, is you can chain stumble recovery drills together in order to really push you to create more and more creative situations and more creative answers to common problems. So, if this is new to you, this three-part step here might have been a little bit overwhelming. So let me take you back through it. So one way this could have worked is your patient's airway was too anterior for the blade you chose. Okay, great. Your first recovery drill, your first recovery move is identifying that and calling out for a different shape blade. Now, when that didn't work, when it slipped out of your hand and ended up on the floor, your next move is going to be to take a different size blade, but also to take a bougie to really get access to it. When none of that worked and you ended up in a can't intubate, can't ventilate situation, then you're going to go through mentally the practice of performing an emergency crike. And you're going to end when you secure the patient's airway, because we end in success. That's why we end with applause. Okay, that brings us through the 4 techniques. And I hope that you found something useful in there. I hope you found something that you like. And I hope that these are jumping off points for you where you can really explore and deepen your own sense of practice. More than anything, though, I hope you recognize some of the power of mental visualization and that you get excited about the idea of moving beyond just sort of thinking about things into being a really active participant in mental simulation. Just as a quick review as we're done here, what are some of the things that we did in this talk? Well, we talked about using multimodal cues and performing in situ visualization to create this rich, detailed, multidimensional environment to visualize in. We talked about leveraging expertise and the importance of ending in success when we visualize. We talked about finding negative space and identifying areas where our visualization breaks down, and those being areas that we really need to improve or work on. We talked about the idea of doing a premortem, starting with failure and working backward to figure out why. We talked about adding pressure, both physiologic and emotional. And ultimately, we ended with some stumble and recovery drills. Okay, that about does it. I hope you found this useful. Good luck out there. Enjoy visualizing, enjoy your mental sim lab, challenge yourself, get after it, and good luck. Thank you.